for 25 years and love my baby, love my pediatrics. But the journey has been a journey of peaks and valleys, ups and downs. And so through that experience, I complemented my medical experience by becoming a certified professional coach and really learning how to navigate this thing called healthcare so that it just doesn't benefit the patient, but it also benefits the providers. And I think that's very important. So often when we go to conferences, we learn about the latest in research and technology or new policies and procedures that they want us to put in place when we go to the bedside of our patients. But there's always that missing piece, and that missing piece is us. So that gives you a little idea of why I do the work that I do now. I still practice and I still see the patients and the families, but because of the strategies that I put in place and the strategies that I teach, it's transformed how I show up in medicine. It's transformed how I feel about myself when I show up in medicine. And that's what I'm going to share with you today. So that's a little bit about me. I heard a little bit about you all, but let me just ask the question. How's everyone feeling today?
Sleeping.
Sleeping? Okay. I've been where you are. And I've been in lectures where, it's hundreds of people and I'm the one in the back sleeping. Right? Yeah. Okay, great. So I'm going to share that, my journey to get here was more than just getting through the traffic, and there's a lot of traffic in Barbados, more than I even imagined. But it started yesterday, getting up at 4 o'clock in the morning in wintry weather, cold, and as each step of the journey, when I got into a taxi on the way to the airport, I asked myself, is now the time for me to talk, right? We just did the stress scale. So I've left some of the stresses in my life back home, hoping not to get a phone call, hoping not to hear about what's, gone awry, because I left aging parents back at home. But I had to recommit to my purpose of coming and sharing and communicating with you all. And so when I'm asked to speak to groups, I ask myself, what is it that I can share of my journey that's going to be of value to you? And it may be something different for each one of you, but my intention is that you walk away with something that you can now use in your own experiences to improve how you show up in medicine. That word enrichment means it's the action of improving or enhancing. So it doesn't mean that there's anything wrong with us where we are now. It means that we get to grow into even greater parts of ourselves. And because for me, that's something that I really get excited about. So when I work with physicians, I mainly work with physicians dealing with stress and overwhelm. And when I work with physicians, I teach them the 5 pillars of success. And that's what I'm going to share with you. And pillar number 1 is your life all in. There's a reason why you decided to become a nurse. And there are going to be days when you question that reason. Okay? There are going to be days when you don't even know how you ended up here. I've had those days. I've been there, right? There was a period of time in my career where I felt like there was so much just mundane and routine, and I didn't really understand the power of what I was doing. There was more death, working in the level 3 NICU with 23 and 24-week babies, and pushing the envelope and wanting to do more, and parents not wanting to give up, and vital signs not changing when we're giving all the medications we possibly can, and blood cultures not becoming negative when we're giving all the antibiotics we can, and the baby's not making it. And you ask yourself, why am I doing this? How am I helping? And there came a point in time in my career where I put all the walls up, and I just went to work, did the job, and came home. And I would go to work, do the job, and came home. And the walls were up, right? As long as those walls were up, the death couldn't hurt me. But what I didn't realize is I wasn't enjoying what I was doing. There was no joy in what I was doing. And we're here in this life to do things that bring us joy and have a positive impact in our lives. And when we're not feeling the joy, our patients know that we're not showing up as our best selves. Our patients know it. And so that began my journey. That was the impetus for me to find another way to be in medicine. And so your life purpose, going back to your reason why. And sometimes it hasn't even fully unfolded for you yet. But if you go back to that reason why you decided to be in nursing, to be a nurse, and you're able to just find that one thing that you can hold on to as you commute to work, as you feel that angst in your stomach when you see the hospital. And instead of focusing on that angst, you say, wait a minute, back up. This is why I'm supposed to be doing what I'm supposed to be doing. That's when you create an opening. You create a shift for yourself. One of the things I learned about that by figuring out your life purpose is the 5 whys. Ask yourself 5 times, why am I doing this? You know, why? Because the first couple of times that you give yourself an answer, it's going to be kind of a superficial answer, right? Maybe I'm doing it because it just seemed it was the most natural thing for me to do. I needed a career that I feel is going to be sustainable, reliable, some security might be built in there. But as you ask yourself again, another why, you clear away that superficial and you get down to the deeper purpose as to why you selected this career. When I think about my why has taken so many twists and turns that I could never have predicted, right? My why has brought me right here to this moment in time. All through a series of events and supporting family members and just things that I never in my wildest dreams when I went to medical school thought that I would be here today. You know, it was not in my vision. But it's part of my why. It's what keeps me going. It's what got me on the plane yesterday to be here today. So that's pillar number 1 is your why. Pillar number 2 is spiritual awareness and understanding that we are not just put here to work in isolation and work alone, but piggybacking on our life calling and our purpose. There is a higher power that has guided us to whatever it is that we're called to do. And that's not just whether you're a nurse or a doctor, it's everything that we interact with in the world, right? It's everybody has their own role. We're meant to work together. And when we connect to our spiritual awareness, when we connect to knowing that there's a higher power that's there working through us, when we're in the trenches, when we're in the dark places, when we're in those experiences that stress us out, that's when you get to breathe and know that that higher power is working through you. So as part of my job, I go into the delivery room. And sometimes it's a stat, and the mom may be crashing, or the baby's heart rate, the fetal heart rate is dropping. And I'm setting up, I'm doing the things that I know to do. And maybe unbeknownst to everyone else, but I'm also tapping in, right? Because if I get too caught up with doing the things that I need to do, setting up, preparing, making sure the oxygen is there, there's a lot of nervousness that can come, right? And that's not going to serve the baby. That's not going to serve the team that's going to work with me to resuscitate this baby. And so it took me time to realize that rather than shutting everything down, I get to open up and I get to allow God, for me it's God, it may be something else for each of you, but I allow God to work through me. And that has changed the experience. That has brought the joy through it. And that's taking some of the pressure off, right? Yes, I have to know what I'm doing. Yes, I have to review the medications. Yes, I have to make sure I have all the equipment that's there, right? But I don't have to carry all the weight of it. And just lifting off some of that weight allows me to jump into the trenches, do what needs to be done for the patient, and be okay. It took me years to learn that. Okay, that's pillar number 2. So we talked about life calling and we talked about spiritual awareness. Pillar number 3 is personal development. Guys, we didn't learn everything that we needed to learn in nursing school, medical school, in our training and our clinical experience. We didn't learn everything. And so often we graduate, we get our certificates and our degrees, and we think that we know everything. But there's so much else that it takes to work with people when they're at their most vulnerable. There's so much else that it takes to be vulnerable in these settings that they don't teach us in school. It's not in the test. It's not online. It comes from participating in experiences like this. It comes from being in the experience. It comes from sharing and talking about with others, right? In medicine, we don't talk about, this doesn't feel right. We don't talk about when we feel out of sorts, right? We don't want our colleagues to know that you're questioning yourself. You're questioning your ability. That's not something that's, openly talked about and frowned, and sometimes even frowned upon, right? We've now shifted in medicine kind of around this whole COVID era, talking about the burnout that we experienced. That was, when I began in training, that word was never even talked about. You never knew that your colleagues had burnout. The only thing that you knew is that there was this doctor, when you knew that doctor was coming, you said, look out. Because you didn't know what mood they were going to be in, and you don't know if it's going to be a shouting match, or if they're going to be pleasant. Sometimes you said, hey, this guy got to be schizophrenic. You just did not know what to expect. But all of that was part of the burnout, right? All of that's part of not having a structure in place to always refill your cup, so that you're delivering from your overflow rather than delivering from empty. And so that's what personal development does for you. Personal development allows you to say, okay, maybe you don't have that trusted colleague in your work setting, but maybe that person is in your life, where you can say, you know what, I need to go to this conference to learn this. Or I need to be in this group to learn that. I think one of the great things about social media, we use social media for a lot of things, but one of the things that's come out of social media is that we can now be in communication and in community with people from all over, and people begin to share. Now you have to be judicious about what you get from the groups, right? You have to really be able to make sure it's what you need, because sometimes you can find yourself going down a rabbit hole with another person, but you at least break through that feeling of being alone, of being in isolation. That's personal development. Pillar number 4, relationships, family, teams. So important, critical for success in the healthcare system. It combats operating alone. It allows you to be in community. And it is important to know that these relationships that you're fostering are those that are going to support you. And so I share the 5 positions that you need to have on your team, whether it's in your personal life or your professional life. Number 1, you need to have a champion. You need to have somebody who is going to be the president of your fan club, who is going to cheer you on. Not just when you get the degree, but when you come home and you're excited, because you know what, you just had a good day. Some people don't understand that, you know what, it was just a great day. Nothing spectacular happened. Everything worked however it was going to work. Maybe some patients did well, maybe not. But you were able to move through the day with a new sense of ease and flow. And you want to share that with someone. And you're excited to share it with someone. That's who your champion is. That person who's going to cheer you on. And then you also need your nurturer. Your nurturer might be, you might think of that person like as your mom, right? When you were a baby and you were able to lay on your mom's shoulder and your mom just took care of you and covered you. The nurturer is the person who is going to be your safe place to land. Think about who that might be in your life. Things didn't go so well today. It started out as I got stuck in that traffic and it just set me off. And I could never get out of that energy. And everything just seems to be one traffic jam after another throughout the day. That's when your nurturer comes in. And lets you know that it's going to be all right. It's all right. Whatever you're feeling is all right. That's your nurturer. And then there is your motivator. That motivator is going to get you always going. You know that day when you're like, no, I'm not going to work today. I don't feel it. No particular reason why. No, I'm not sick. then there is your visionary. And I kind of love the visionary because I'm a procrastinator, and so I may have a lot of things that I want to get done, but I can procrastinate until next year to do it, okay? So I love the visionary because the visionary is going to keep me on point. It's going to remind me of all the things that I said I wanted to do and help me move forward. Who is the visionary in your life? Who is reminding you of your greatness? And it doesn't have to be in your career. Maybe it's learning a new sport. Maybe it's, starting something, a new hobby, new interest, something that you've always wanted to do. That when you do it, it's going to support your overall well-being, which is going to benefit your career and life. You need the visionary. And then you also need the warrior. The warrior gets you going. The warrior says, okay, you've been talking about the vision long enough. What's going to be that next one step that you take to make a difference in your life? That's the one. So I shared the 5 positions for a successful team, okay? I want you to remember them, think about them, we're going to talk about them later. We said there is what's the first one, Melissa? And then there's the warrior and the visionary, okay? So think about them, remember them. Think about who is in your life that can fit each of those roles, and then think about who are you? Which position do you feel in somebody else's life? Okay? Can we do that? All right. And then, so that's the 4th pillar, which is family and relationships, and then the 5th pillar is abundance and prosperity. And while oftentimes when we talk about abundance and prosperity, we talk about it in the context of financial, I want you to blow that whole thought about it up. And I want you to focus more on who is it that you know you're to be. What do you think about when you think about, I'm a nurse? Right? What does that mean to you? Do you feel like it's something that's collapsing in on you? Or is it something that allows you to fully step into the greatest parts of you? Expanding the vision of what it means, both the professional you and the personal you. Because when we allow ourselves to expand the vision of our professional lives, it doesn't mean that things are necessarily going to change outside. It doesn't mean that we're going to go into the hospital setting and all of a sudden everything has changed for us. But it means that we have a better understanding of your part in the greater picture, right? So I'm not just here to set up everything, and I'm not just here to do a physical exam and order the lab. But I get the opportunity to come in my case, meet with the families and make sure that families understand what's going on with their babies, right? And not leave them in the dark. I have the opportunity to make a difference for a young mother who maybe she lost her baby. And maybe, I'll go back to a story where one mom said to me, she had twins and one died. And she said, my coworkers don't know what to say to me because they want to congratulate me on the one hand, but I buried one of my children, one of my babies. Or the mom goes to the hospital to deliver, and then the baby stays in the hospital, and the mom goes home. And the family members are like, when's the baby coming back? When's the baby coming home? And so while she's grieving the disruption of her birthing plan, she also has family members who, not their fault, but they don't know how to support her. And sometimes the only supports they get is from us. So we get to, expand the vision. And when we do it in the way that supports us, it doesn't have to take anything more from us. Sometimes we think, if I spend a little bit more time with this patient, I'm not going to get my work done. But when we understand that this is part of the work that we're meant to do, that we're called to do, part of going back to our life calling, it's part of it, then we can extract the joy from connecting with someone, heart to heart, right? From caring about and caring for someone in a different way, and still be able to walk away, get our work done, and have a great day. Okay? I have an interactive exercise I want to do with you all, but before we shift to that, any comments, questions, things you want to share? Thoughts, feedback?
I was touched from the time that I walked in and hearing Chaplain Paul, and he only touched on stress. I do think that I should go back and tell Mr. Pinder that every single person in QEH needs to pass through this course.
Thank you.
Awesome. Awesome.
All nurses, all. This is only journey nursing.
So you're going to just started.
Oh, awesome.
That's awesome. Why do you say that? Putting you on the spot, sorry.
No, that's right. Because I can relate with you because of some of what you've said, because that's the type of person I am when I'm caring for my loved ones and my staff. But, and I think it's all because I go back to our upbringing, and especially with this generation now, sorry to say it, but I'm not seeing that. I'm not seeing that. For example, you go to A&E and, other departments, not only A&E, but it's like, where am I? I wouldn't even carry my dogs that I love so much to some of these departments, and I'm serious. And then, for example, when I take my little ones to the vet, it's like, what you're talking about. So you understand, and we're dealing with lives there. So I do think that all nursing personnel should pass through this training. Well done.
Just started.
Yes.
Okay. Any other comments, questions? Okay, I'm going to come around with 2 sets of envelopes. I'm going to ask you to pick one white one and then any of the pastel colors. Your pick. Why did you pick the envelope? Okay, did anyone not want to take the envelope? Okay, and then piggyback on what you said, why did you pick the color that you picked?
My favorite.
That's your favorite color, okay.
Green is for life.
Green is for life. Okay. So imagine it's your shift, you're coming onto your shift, right? Tell me a little bit about who is in the hospital on the clinical floor. All of you, okay? So tell me what it's like when you're coming in on your shift. What happens? How do you get the patients that you get? What's the process that you go through? Anybody?
Okay, so I wear artificial kidney.
Yes.
So, come on, share, and your patients come in. And some of my patients are palliative care, they're to receive dialysis. So, we know how to walk in somehow.
Okay. I love what you just did. Go ahead. I love what you just did. You know what you just did? I love it.
That's how they walk.
Okay.
And you try to cheer them up, because this is me. Good morning, call them by the name, how are you this morning? And then you start to attach them to the mission. That's what we do on our team. Me, the manager of the unit now. There are times when chaplain calls it when you see the hospital. Sometimes it's not when you see the hospital. I've been through a circumstance where it's the person's thinking they're toxic because some of them, the behaviors or some of them, if I have to speak to them as the manager, they're not happy with that. So it's like, I have to go into there, especially if this person is not doing it. So it's kind of, want to go, but still, it's something. So when you get to the door, I am this person, make a sign of the cross. That's the,
Okay. Awesome.
but you look forward to see your patients, to be able to care for them, to let them feel that.
Okay. Anybody else want to share the experience where they come into work and you have experience for them?
Depends on the team on a particular day. So sometimes you do work can do initiate and you're working with your friends and you good team and you do a good job, you excited to come work and stuff. And And then the shift change, and you got put on top of it, shift, now you're like, you don't want to be, but it's just like truly a while. Like, so happens that sometimes when you shift, and you don't want to be, that just make a big difference on that shift.
Yes.
You're a
Awesome.
stronger person, and it's anything that I was here for a reason.
Awesome, awesome. So when we come to work, we want our favorite color, right?
Yes.
We want our pink. We want our favorite color, our green, which signifies life. So what that tells us is we all have filters, right? And those filters are going to determine what we are going to interpret, how we're going to interpret the experiences that we're about to go through over the course. How long are your shifts? 12 hours, 8 hours? 8 hours.
Some 8, some 12.
But that's a significant chunk of a day, right? We sleep 8 hours, and we're at work 8 hours, and we're in commute, in traffic for another 2-3 hours. That gives us just a little bit of time really for ourselves. So we're already conditioning ourselves based on what we perceive, based on our filters. So you've got the pink. Pink is your favorite color? Tell me what's in your pink. What does it say?
I feel so helpless.
Is that pink color?
No.
Energy? No. Who else told me they have their favorite color? You want to go home, right? So pink, you told me your green was life. Green was about life. What's life? Say.
You're gonna get back to work.
I gotta get back to work. Okay. Okay. What's yours say?
Doesn't make sense.
It doesn't make sense.
I hate doctors, nurses, the hospital.
Tell us.
Leave me alone.
Okay. I'll leave you alone. Crystal, what do you have?
He has a check for you.
A check. Your yellow is coming for you. It's what? It's hopeless. That check is gonna bounce there.
I have done all the right things. How can this happen?
How can this happen? It can't be happening. This can't be happening. So tell me a little bit about what those statements tell you. Who do you hear those statements from? Who might you hear those statements from? Patients. Okay.
Your peers.
Who said yourself? Yes, yourself, right? And so you get to see that we're all just having a human experience, right? And it all depends on what side that you're on, right? Maybe it is that check that we're expecting and instead we get some junk mail, right? And we really needed that check. Or maybe the patient comes in and there is a test result that they're waiting for. And they really need that test result to be great, and it's not, right? And so, tell me what's in the white envelopes. What do you think what's in the white envelopes? Hopefully something good, okay? Go ahead.
What will make you feel better?
Ah.
What questions do you have?
Mm-hmm.
You are not alone.
Oh, I like that one. You like that one?
Yeah.
I like that one.
But you're not alone.
That's understandable.
That's understandable.
Makes sense. I really don't understand.
Okay, okay. I'm here to help.
Told me I support you.
Tell me that again.
Told me I support you.
I support you.
Today is the best day. I'm here with that.
I'm here to help.
Thank you.
Who might be telling, who might the white envelopes, what might these statements be? The nurses to the patients, okay? And what else? So remember the 5 positions that we talked about? The nurturer, the vision. So that may also be people in your lives who are going to support you as you go out and do the great work that you're doing. follow them. You know what? This person, when I hear them speak, this person uplifts me. This person moves me to action. This person reminds me of the greatness within me. So you get to, you know what you need. Here's the thing, we all know what we need, right? And there's that saying out there that we all have everything that we need. I didn't used to believe that. Not at all. Things were just, he talked about the stressors, so not to overshare, but I had a 1-year-old and a 3-year-old, finishing fellowship, starting my medical career, and I was in divorce. I didn't feel like I was having everything that I needed, right? But I did, because I had other support systems. I looked at other people in my life to fill some of the other roles so that I was able to keep going, okay? And so I invite you to look at the contrast between, a pretty envelope that looks great, but maybe the news isn't so great, maybe the supports aren't there, and then what is possible comes from your blank slate. That's why these are white. It's your blank slate. You can create whatever you need. Right? You can create whatever the patient needs. So our patients may not come to us and say, I'm scared, I'm fearful, I'm out of control. Right? They may not use that language. They'll say things like, I feel like it's a bad day.
That's a look on the face.
Sometimes just look on their face. See what her body language was? That body language, critical, and we get to be the experts in that, in the body language. And not so that it's another burden for us, but so that we can meet our patients where they are. We can figure out what is it that this patient needs, Does this patient need someone who can just take 1 minute when they do the vital signs and look at them in their eyes and say, I can see you're not feeling so well today. I can see that, So you had 2 cards that said, one said it's, I don't understand this.
It doesn't make sense.
It doesn't make sense.
That's
That's understandable. So for the patient, it may not make sense why all this is happening. And I get to empathize with them. And I get to say, you know what, I can understand that. It doesn't make you crazy. You may not understand why you have this disease process going on. You may never know why. You may have done all the right things, eaten all the right foods, done all the screening, and still you get this diagnosis. But I can come along, or your healthcare provider, or your team member can come along, or your family member can come along and say, it's understandable that you feel this way. It's understandable that it doesn't make sense to you, but we can walk this journey together. Feedback, questions, comments? Okay, I thank you for your participation. I hope you walk away from this exercise and you carry it with you as you go back to take care of your patients and think about, what's that patient telling me that they're not telling me, right? What does their outer shell look like that might be giving clues to some other information, slumped over, the sad demeanor, the face? And what can I now do